Focused ultrasound ablation surgery. How to manage pancreatic cancer, a deadly disease, without open surgery. Pancreatic cancer is famous as the king of cancer. It is notoriously difficult to diagnose, especially for early diagnosis. 80% of patients are found in advanced stage and lost the chance of surgery. It's hard to have treatment. The chemombolization effectiveness rate is less than 30% due to a lack of effective drugs, and as a tumor of the digestive system, it is often accompanied by fatigue, emaciation, malnutrition and gastrointestinal symptoms. Patients are hard to tolerate chemombolization. It is difficult for them to persist chemombolization for a long time. Luciano Pavarotti, the world-known operatic tenor, Shen Dianxia, the famous actor, and some other celebrities all died from pancreatic cancer, faced with a disease that is difficult to manage. Except for the surgical procedures, resections, radiotherapies and chemombolization. Is there a treatment method that is effective and less painful? Also well accepted by the patients? Of course there is. It's conducted by the Haifu focused ultrasound tumor therapeutic system, that is, high-intensity focused ultrasound, HIFU, ablation treatment. HIFU is a technology that can kill pancreatic tumor without incision or puncture. It's a non-invasive procedure. It's also a green surgery. There are no symptoms of fatigue and loss of appetite caused by chemombolization. It has many advantages, such as non-invasiveness, mild side effects, etc. The technical principle is to utilize the penetrability and focalizability of ultrasonic waves in the human body. The extracorporeal ultrasonic waves penetrate the skin, fat, abdominal muscles and other tissues, then focus on the pancreatic tumor in the in vivo. Physical effects of the focus will rise the temperature in the tissue of the pancreatic cancer lesion to more than 65 degrees, causing coagulated necrosis, and achieving the treatment purpose generally. The principle is like sunlight focused under a magnifying glass. The temperature of the focus can be similar to the ignition point of leaves. Haifu focused ultrasound tumor therapeutic system, for the treatment of pancreatic cancer, has the following advantages. No surgical procedures, no bleeding, no stitches, to avoid causing new wound. Small impact on physical conditions, to avoid causing fatigue, nausea, vomiting, hair loss and other chemical damage. Direct thermal ablation kills pancreatic tumor lesion, controlling tumor growth, and effectively prolonging survival time of the patients. Relieving pain, reducing the dose of analgesic drugs, improving the quality of life. Patients don't even need to take painkillers anymore. Many patients have no longer suffered from insomnia caused by abdominal pain. They can finally have a good sleep. Quick recovery. Patients can eat and get up from bed 2 hours after surgery, 2 hours after operation. Patients can leave the hospital if there is no special discomfort. Repeated treatment. After admission, patients with pancreatic cancer will undergo imaging examination first to confirm the size and position of pancreatic cancer lesion and the adjacent relationship of peripheral blood vessels and intestinal tract. Then the treatment plan of focused ultrasound ablation procedure will be formulated. Preoperative bowel preparation is required, such as oral laxatives to empty the intestinal tract. We also need to explain the principle and process of the focused ultrasound treatment for patients to shake off their worries about surgery, because non-invasive therapy doesn't require deep anesthesia as traditional surgery. Even patients who are too old and too weak to tolerate general anesthesia, they can have the treatment under sedation and analgesia. After anesthesia, patients can be up and about. Patients can usually leave the hospital the next day after surgery with no impact on daily life. The treatment of pancreatic cancer is a common problem worldwide. Focused ultrasound ablation surgery without surgical incision, because of its advantages such as non-invasiveness and well physical tolerance, it has become a comprehensive treatment for pancreatic cancer, protecting the health of patients with pancreatic tumor.